Case F file 5520 HHS. Classification level declassified under FOIA request 2024 HHS-00881. Originating agencies: Department of Health and Human Services, Office of Inspector General, Federal Bureau of Investigation Healthcare Fraud Unit, Houston Field Division, Internal Revenue Service Criminal Investigation Division, United States Attorney's Office for the Southern District of Texas. Subject: Systemic Medicare Part 500 billing fraud, ghost prescriber networks, dead patient claims, structured money laundering through commercial real estate. Total loss to federal health programs, $212,400,000. Defendants, 6. Convictions, 6. File opened March 14, 2019. File closed for active prosecution November 9, 2023. This is the record. Within the spring of 2019, a data analyst named Carol Figueroa was working a Tuesday morning shift at the HHS-OIG National Analytics Center in Washington, D.C. Her desk faced a wall of monitors. Her coffee had gone cold an hour ago. She was running a routine quarterly cross-match, Medicare Part 500 claims data against the Social Security Administration's Death Master File, a federal database that logs the date of death for every deceased American whose death was reported to the Social Security Administration. The cross-match was standard procedure, a sweep meant to catch billing errors and the occasional low-level fraud attempt by a clinic that forgot to update its patient roster. It turned up false positives all the time. Most weeks it turned up very little worth pursuing. That Tuesday morning, it turned up something that made Carol Figueroa set down her cold coffee and stare at her screen for a long time without moving. 11 patients, all listed as deceased in the Death Master File at dates ranging between 7 and 22 months prior, had active Medicare Part 500 prescription drug claims filed against their beneficiary numbers in the preceding 90 days. 11 dead people by the federal record, whose Medicare numbers were still being used to bill for prescription drugs. By itself, 11 cases was not unprecedented. Enrollment lags happened. Reporting delays between state vital records offices and the SSA created windows of error. Figueroa had seen claim-after-death anomalies before. What was different this time was the pharmacy. All 11 claims traced back to a single provider, Meridian Pharmacy Group, LLC. Meridian operated 12 retail pharmacy locations across Houston and the surrounding counties of Harris, Fort Bend, and Montgomery. On the surface, it appeared to be an unremarkable regional chain: 12 storefronts, a corporate billing office on Westheimer Road, a standard NCPDP provider number, and a Medicare Part 500 enrollment in good standing since 2011. The claims from the 11 deceased beneficiaries were for specialty drugs, expensive ones, immunosuppressants, oncology-adjacent medications, branded biologics, drugs with average prescription costs running between $1,200 and $4,400 per 30-day supply. Figueroa ran the search back further. 90 days was the standard window. She expanded it to 18 months. She found 207 claims, 207 prescription drug claims submitted to Medicare Part 500, billed against the beneficiary numbers of patients who, according to the Death Master File, were dead before the prescriptions were written. The claims spanned 41 unique deceased beneficiaries. The total billed amount across those 207 claims was $3,841,000. Figueroa flagged the file, attached her query parameters and output tables, and sent it up the chain to her supervisor at the OIG's Office of Investigations with a one-line note: recommend referral to field office for further development. The supervisor read it, agreed, and forwarded it to the HHS-OIG special agent in charge, responsible for the Houston region. That referral landed on the desk of Special Agent in Charge Raymond Albrecht on the afternoon of March 14, 2019. Albrecht read the file carefully. He had spent 19 years investigating Medicare fraud. He had seen billing after death before. He had also seen it used as a cover pattern, a deliberate obfuscation strategy where fraudsters seeded a billing stream with claims against deceased beneficiaries alongside much larger fraud against living ones, on the theory that investigators would pull the dead patient thread close it as a sloppy billing error, and never look at the live beneficiaries at all. The scale here was too systematic for sloppy billing. 207 claims, 41 deceased beneficiaries, all from one chain. He opened a preliminary inquiry. He assigned 2 HHS-OIG special agents, Patricia Morales and Dennis Kwang, to begin a records pull. Then he picked up the phone and called his counterpart at the FBI's Houston Field Division. The FBI agent he reached was Supervisory Special Agent Thomas Devereaux, who ran the Healthcare Fraud Squad out of the field office on North Loop West. Devereaux listened to the summary. He asked 3 questions. What were the prescribing physicians? Were the claims concentrated in specific store locations or spread across the chain? And had the OIG pulled the beneficiary numbers for living patients at those same stores yet? Albrecht said they hadn't gotten that far. Devereaux said he'd be interested in whatever came back on those 3 questions and suggested they talk again in 2 weeks. What came back on those 3 questions over the following 3 weeks changed the nature of the investigation entirely. The prescribing physicians on the deceased beneficiary claims fell into 2 categories. The first category was real physicians, licensed Texas doctors whose DEA numbers and state medical license numbers matched active registrations. Several of them were internal medicine practitioners with general practices in the Houston metro area. The second category was something else entirely. Special Agent Morales ran the prescriber NPI numbers, National Provider Identifier numbers, the unique 10-digit identifiers assigned to every licensed healthcare provider in the United States through the NPPS database, the National Plan and Provider Enumeration System. Of the 47 unique prescriber NPIs appearing on the deceased beneficiary claims, 31 came back as valid active physicians, 16 did not, 12 returned as inactive or revoked, physicians who had retired, surrendered their licenses, or died. 4 returned as invalid entirely. NPI numbers that appeared nowhere in the federal registry. 4 prescribers whose NPIs did not exist. Morales pulled the actual claims forms. The prescribers with non-existent NPIs had been used on 38 of the 207 flagged claims, concentrated in a specific billing period between August 2018 and February 2019. The prescriptions attributed to these ghost providers were all for the same category of drug: high-cost branded specialty medications, predominantly immunosuppressants used in transplant medicine and certain autoimmune conditions. Meanwhile, Special Agent Kwang had pulled the Medicare Part 500 billing data for all 12 Meridian Pharmacy Group locations going back to 2015, the furthest point the OIG's administrative subpoena could reach without a federal grand jury. What he found made the dead patient claims look like the visible tip of something far larger. Meridian Pharmacy Group had billed Medicare Part 500 for a total of over $200 million across those 4 years. $212,400,000 to be precise. The chain's combined retail revenue from their 12 Houston area locations, as reported on their federal tax filings, was approximately $47 million over the same period, a figure consistent with 12 modestly successful regional pharmacies. The gap between their reported retail revenue and their Medicare billing was a chasm that had no legitimate explanation. The billing was concentrated in 3 of the 12 store locations: a location on Gessner Road in Southwest Houston, a location on East Nassau Parkway in Webster, and the corporate headquarters on Westheimer Road, which operated both as a retail pharmacy and as the chain's central billing office. Between those 3 locations, 91% of all Medicare Part 500 billing had been processed. The other 9 locations contributed normal, unremarkable volumes. Kwang compared the beneficiary rosters. The 3 high billing locations had enrolled Medicare beneficiaries whose addresses were spread across Harris County in patterns inconsistent with geographic proximity. Patients in Clear Lake filling prescriptions through a pharmacy in Southwest Houston. Patients in Katy filling through the Webster store. Some beneficiaries appeared enrolled at multiple Meridian locations simultaneously, which was functionally impossible for a patient filling regular prescriptions at a single neighborhood pharmacy. Devereaux and Albrecht convened again on April 9th. This was no longer a dead patient billing audit. This was a large-scale Medicare fraud operation. They agreed to open a joint federal investigation. Devereaux would coordinate through the FBI's healthcare fraud unit and bring in IRS criminal investigation for the financial side. Albrecht would keep HHS-OIG as the lead data agency. They would seek a grand jury in the Southern District of Texas and begin building toward federal search warrants and indictments. The investigation was given a working file number, Case 5520. The name on the corporate documents for Meridian Pharmacy Group, LLC, was one Marcus Alton Briggs. Marcus Alton Briggs was 53 years old. He had grown up in Beaumont, Texas, worked briefly as a pharmacy technician in his 20s, and obtained a pharmacist's license from the Texas State Board of Pharmacy in 1993. He had owned and operated independent pharmacies for most of his adult life, starting with a single location in Pasadena, Texas, which he had sold at a modest profit in 2001. By 2011, when Meridian Pharmacy Group was incorporated in the state of Texas, Briggs had accumulated enough capital and enough banking relationships to open multiple locations simultaneously. Briggs was the sole owner of Meridian Pharmacy Group's management company, Meridian Healthcare Solutions, LLC, which received a management fee from each of the 12 pharmacy locations, a fee that agents would later establish allowed the movement of money between the operating entities and the parent company with minimal paper trail from the pharmacy-level billing. He drove a 2018 Mercedes-Benz S-Class. He owned a house in the Memorial area of Houston appraised at $1.3 million, purchased in 2017 for cash. He owned 2 commercial strip centers in Katy, Texas, acquired between 2016 and 2018, and a 40-unit apartment complex in Stafford. He sat on the board of a Houston area charitable foundation. By every visible metric, Marcus Briggs was a successful, if affluent, small business owner. IRS Criminal Investigations Special Agent Renata Kowalczyk was assigned to the financial component of Case 5520 in late April 2019. She pulled Briggs's personal and business tax returns under a grand jury subpoena. The returns showed income consistent with a profitable pharmacy chain, substantial but not outrageous. The cash purchases of real estate were not disclosed as coming from any specific source. They had been funded through a series of LLCs, with names like Longhorn Commercial Properties, LLC, and Gulf Coast Real Holdings, LP, entities whose own operating accounts showed capitalization events that traced back at several removes to accounts at a bank in Houston held in the name of Meridian Healthcare Solutions. The pharmacy chain was billing $200 million to Medicare over 4 years. The money was flowing through the management company, being sifted into a constellation of real estate LLCs and emerging as commercial properties and apartment buildings. The buildings were then refinanced through conventional commercial mortgages, producing clean loan proceeds with documented property values as collateral. The mortgage proceeds went into Marcus Briggs's personal accounts and were reported as loan proceeds, not income. It was a 3-stage laundering architecture: generate fraudulent Medicare revenue, flow it through the management entity, convert it into real property, leverage the property for legitimate mortgage financing. The mortgage produces clean money. The original fraud receipts are buried several transactions deep under property records. Kowalczyk flagged one additional element. The Meridian billing office on Westheimer had, over the preceding 3 years, made cash payments totaling approximately $4 million to a set of individuals identified in the pharmacy's internal accounts only by initials, 7 individuals referenced by abbreviations that appeared nowhere in the standard payroll or vendor records. These were separate from the salaried pharmacy staff, separate from the licensed pharmacists, separate from any vendor relationship Meridian had ever disclosed to its bank or its accountants. Those 7 individuals, the investigators were beginning to suspect, were the source of the prescriptions. The prescriber network was the mechanism at the heart of Case 5520. Over the course of the summer and fall of 2019, FBI agents Devereaux and his team, including Special Agents Linda Park and Albert Fontenot, built out the prescriber side of the scheme through a combination of subpoenaed records, confidential informant development, and controlled contact with physicians whose names had appeared on legitimate Meridian claims. The scheme operated on two parallel tracks. Track 1 was the legitimate physician network. Meridian had cultivated relationships with approximately a dozen real, licensed physicians across the Houston metropolitan area. These physicians operated in internal medicine, geriatrics, and primary care. They had been approached at various times between 2013 and 2018 by individuals representing themselves as Meridian Specialty Services consultants, pharmacy outreach representatives who explained that Meridian had developed a streamlined specialty drug fulfillment program for Medicare Part 500 patients needing high-cost medications. The pitch was polished. Meridian could handle prior authorization, patient paperwork, and insurance navigation for specialty drugs at no cost to the physician's office. All the physician needed to do was route appropriate patients to Meridian. For some physicians, that was the extent of the relationship, and those physicians had no reason to suspect fraud. Their patients received the medications. Meridian handled the billing. Everything appeared to work correctly. For a smaller subset, 5 physicians, the investigation would eventually establish, the arrangement went further. Meridian's consultants, acting under Briggs's direction, had presented those 5 physicians with rosters of patients. The rosters included individuals the physicians had never seen. The physicians were told these were referral patients, transferred from other practices, who needed prescription renewals. In exchange for signing the prescription forms, the physicians received cash payments, delivered in envelopes, in amounts ranging from $500 to $3,000 per batch of signed forms, paid at intervals of roughly every 6 to 8 weeks. This was the kickback network. 5 corrupt physicians, compensated in cash, signing prescriptions for patients they had never treated, patients who were, in many cases, deceased, or enrolled with false addresses, or entirely fictitious. Track 2 was the ghost prescriber infrastructure, for claims that even the corrupt physicians might have hesitated to sign prescriptions for beneficiaries whose dates of death were close enough to be obvious on a cursory look, or for beneficiaries enrolled at impossible addresses. The Meridian billing office used fabricated NPIs. Someone inside the billing operation had constructed a set of false prescriber identifiers, NPI numbers formatted to appear valid, but referencing either long-dead physicians or non-existent provider registrations. These numbers had been used on hundreds of claims, concentrated in the periods when the kickback physicians were either unavailable or when the fraud volume exceeded what 5 corrupt doctors could plausibly sign. One of the 7 cash-compensated individuals in Meridian's internal accounts was identified through informant development as Dr. Harold Vance Otley, a 71-year-old internist who had practiced in Houston's 3rd Ward until his retirement in 2016. Otley had been paid approximately $800,000 over 3 years by Meridian Healthcare Solutions for what his bank records described as consulting services. Agents would eventually show that Otley had signed prescription forms for 414 patients, of whom at least 189 had no documented relationship with his practice, and of whom 31 were deceased at the time of signing. A second individual was identified as Dr. Sandra Michaela Reyes, a 44-year-old family medicine physician practicing in the Pearland area. Reyes had received approximately $340,000 from Meridian. Her case was somewhat different from Otley's. Investigators developed evidence suggesting that Reyes had been approached by a Meridian consultant in 2016 and had, over several months, convinced herself that the arrangement was legal, a mischaracterization that the consultant had apparently encouraged. When agents made controlled contact with Reyes in December 2019, she cooperated immediately and became the investigation's most significant inside witness. Reyes provided investigators with a detailed account of how the kickback arrangement had been structured, who had approached her, what she had been told, and what she had observed of the Meridian billing operation on the occasions she had visited the Westheimer office. She identified a Meridian employee named Derek Odell Washington, 38 years old, who had served as the primary operational coordinator between the pharmacy's billing office and the physician network. Washington, Reyes said, had been the person who delivered the cash envelopes, managed the patient rosters, and coordinated the prescription batches. Reyes identified Washington from a photo array without hesitation. Washington became the second cooperating witness in case 5520. He was approached by investigators in February 2020, placed in a controlled meeting at a Houston hotel, confronted with the documentary record, and advised of his exposure. After consultation with appointed counsel, Washington agreed to cooperate. He provided investigators with a complete operational account of the Meridian fraud from his position as its day-to-day manager. Washington's account filled in the operational architecture that the documentary record had outlined but not fully explained. The scheme had begun, Washington said, around 2013. Briggs had been running legitimate pharmacies for years, making reasonable money, but he had become fixated on the revenue per claim model of Medicare Part 500 specialty drug billing. High-cost medications billed to Part 500 generated reimbursements that dwarfed the margins on ordinary retail pharmacy. The challenge was volume. Legitimate specialty drug dispensing required actual patients with actual diagnoses, prior authorizations, and a referral infrastructure, building that legitimately took time and clinical relationships. Briggs had found a shortcut. The initial phase of the scheme was relatively modest. Briggs identified Medicare beneficiaries whose Part 500 enrollment was active, but who, for various reasons, had not filled prescriptions at any pharmacy in the preceding 6 to 12 months. Beneficiaries who appeared, from a data standpoint, to have no established pharmacy relationship. Some of these individuals were elderly patients who had reduced their medication regimens. Some were Medicare-eligible patients who were using employer insurance as their primary coverage and not billing Part 500 at all. Some, as Figueroa's crossmatch would eventually reveal, were individuals who had died but whose Medicare enrollment had not yet been closed. Briggs obtained beneficiary data through a combination of sources. Washington described a paid intermediary, an individual he knew only as the list guy, never identified by full name in the investigation's developed evidence, who provided monthly rosters of Medicare beneficiaries with specific Part 500 enrollment characteristics. These rosters were sold to Briggs at a per-record price. They contained names, Medicare beneficiary numbers, dates of birth, and addresses, enough information to generate a prescription claim. The billing team at Meridian's Westheimer office, under Washington's supervision, would take a beneficiary from the roster, assign them a high-cost specialty medication, attach a prescriber NPI, either a legitimate prescriber from the network or a fabricated one, generate a claim, and submit it to the Part 500 plan sponsor for reimbursement. The drugs billed were typically not dispensed. In a minority of cases, a cheap generic was dispensed instead, recorded in the internal pharmacy management software as the billed specialty drug. In the majority, nothing was dispensed at all. The prescription was a fabrication from end to end. The scheme's corruption of actual physicians had evolved over time as a response to the plan sponsors' claims review processes. Part 500 plan sponsors had begun cross-referencing prescriber data with provider enrollment records, and claims bearing NPI numbers from non-enrolled prescribers were being rejected. The corrupt physician network provided a layer of cover. Real NPIs from real prescribers made claims far harder to flag through automated screening. The kickbacks ensured the physicians' continued participation. Washington said that by 2016, the scheme had expanded sufficiently that the Westheimer billing office employed 5 full-time staff, whose sole function was generating fraudulent claims. These staff members were paid in cash, above their nominal salaries, and were kept deliberately ignorant of the full scope of the operation, told they were processing claims for a remote fulfillment program, a characterization plausible enough that Washington believed several of them genuinely did not understand they were committing fraud. The money flowed out of Medicare reimbursement accounts at the rate of approximately $5 to $7 million per month. At the scheme's peak, Briggs received the Medicare payments into Meridian's operating accounts, transferred portions to the management company as management fees, used a percentage to pay the cash-compensated staff and physicians, and moved the remainder through the LLCs into real estate acquisitions. Kowalczyk's financial reconstruction eventually traced $212 million in fraudulent Medicare receipts over the 9-year life of the scheme. On the morning of June 3, 2021, a federal grand jury sitting in the Southern District of Texas returned a sealed indictment in Case 5520. The indictment charged 6 defendants: Marcus Alton Briggs on 18 counts including healthcare fraud, conspiracy to commit healthcare fraud, money laundering, and conspiracy to pay and receive healthcare kickbacks; Derek Odell Washington on 12 counts including conspiracy and money laundering; Dr. Harold Vance Otley on 9 counts including receiving illegal remuneration and making false statements to federal healthcare programs; and 3 additional defendants identified in the record as Meridian Billing Office supervisors: Cynthia Renee Holt, age 41, James David Nguyen, age 33, and Patricia Ann Simmons, age 46, each charged with healthcare fraud, conspiracy, and money laundering. Dr. Sandra Reyes was not charged, having received a cooperation agreement in exchange for her testimony. The indictment remained sealed for 63 days while investigators completed the pre-arrest operational planning for simultaneous raids on 12 locations. On the morning of August 5, 2021, at precisely 6 a.m. Central Time, federal agents executed 12 coordinated search warrants across the Houston metropolitan area. The operational plan was coordinated by the FBI's Houston Field Division and involved 81 federal agents and task force officers drawn from the FBI, HHS-OIG, IRS Criminal Investigation, and the Texas Attorney General's Medicaid Fraud Control Unit. The Houston Police Department provided uniform support at 4 locations where access complications had been anticipated. The locations included the Meridian Corporate Billing Office on Westheimer Road, all 12 Meridian Pharmacy retail locations, Marcus Briggs's personal residence in the Memorial area, 2 commercial strip centers in Katy, the 40-unit apartment complex in Stafford, 3 storage units in Harris County registered to Meridian-affiliated LLCs, and the personal residences of Washington, Otley, Holt, Nguyen, and Simmons. At the Westheimer Billing Office, a team of 12 FBI agents and 4 HHS-OIG forensic accountants executed the search warrant beginning at 6:01 a.m. They seized 14 desktop computers, 7 laptops, 32 hard drives from a server rack in the rear office, 4 banker's boxes of printed claim files, 3 filing cabinets of patient records, 2 external hard drives found in a desk drawer by the office manager's workstation, and approximately $43,000 in cash found in a locked cabinet in a back room. The pharmacy's billing management software, a customized installation of a standard pharmacy management system that had been modified, investigators would determine to allow claims to be generated without corresponding dispensing records, was imaged on-site. At Briggs's residence, agents executed the search warrant at 6:03 a.m. Briggs was home. He was taken into custody at the front door by Special Agent Fontenot and 2 other agents as he answered the door in a bathrobe. He was read his Miranda rights, declined to answer questions, and was transported to the Federal Detention Center pending arraignment. Agents seized his personal computer, 3 cell phones, a leather document case found in his home office containing handwritten records of LLC transactions, and approximately $212,000 in cash found in a safe in the master bedroom closet. Washington was arrested at his apartment in the Midtown area of Houston at 6:05 a.m. without incident. Otley was arrested at his home in Sugar Land. Holt, Nguyen, and Simmons were each arrested at their respective residences in the greater Houston area. All 6 defendants were in federal custody by 7:45 a.m. The real estate holdings, the 2 Katy strip centers, and the Stafford apartment complex were simultaneously subject to federal asset forfeiture actions. The forfeiture filings alleged that the properties had been purchased with proceeds of the Medicare fraud and were therefore subject to criminal forfeiture under 18 U.S.C. Section 982. The combined appraised value of the three properties at the time of the forfeiture filing was $8,700,000. 14 bank accounts held in the names of Meridian Healthcare Solutions, its affiliated LLCs, and Briggs personally were frozen by the United States Attorney's Office under forfeiture authority. The combined balances across those accounts at the time of freezing totaled approximately $4,300,000. The federal prosecution of case 5520 proceeded over a 27-month period between arraignment in August 2021 and sentencing in November 2023. The case was prosecuted by Assistant United States Attorneys Gabriela Ruiz Moreno and Christopher Stafford Hale out of the Southern District of Texas. Derek Washington's cooperation had produced an extraordinarily detailed evidentiary record. Over the course of 19 proffer sessions conducted between March 2020 and May 2021, Washington had described the scheme's full operational arc, identified every participant known to him, explained the billing mechanics in sufficient technical detail that forensic accountants could reconstruct individual transactions, and identified the physical locations where cash was kept, exchanged, and counted. Washington's account was corroborated by Dr. Reyes' testimony, by the documentary records seized in the raids, by the pharmacy management software's metadata, which preserved in its transaction logs records of claims generated without corresponding dispensing events, and by financial records tracing money through 7 layers of LLCs to the real estate acquisitions. Cynthia Holt entered a guilty plea to 1 count of healthcare fraud conspiracy on December 14, 2021. She was sentenced in September 2022 to 37 months in federal prison and ordered to pay $2,800,000 in restitution. James Wynn entered a guilty plea to 1 count of healthcare fraud conspiracy on February 3, 2022. He was sentenced in November 2022 to 24 months in federal prison. He cooperated substantially with the government's ongoing prosecution of the remaining defendants and received credit for his assistance in the sentencing recommendation. Patricia Simmons entered a guilty plea to 2 counts of healthcare fraud and money laundering conspiracy on March 17, 2022. She was sentenced in January 2023 to 41 months in federal prison and ordered to pay $3,100,000 in restitution. Dr. Harold Otley entered a guilty plea to 3 counts, receiving illegal healthcare kickbacks, conspiracy to commit healthcare fraud, and making false statements to federal healthcare programs. On April 29, 2022, Otley's defense had argued, at length and unsuccessfully, for a variance based on his age, his lack of prior criminal history, and what his attorneys characterized as a diminished appreciation of the fraudulent nature of the arrangement. The sentencing memorandum filed by the government detailed the scope of Otley's knowing participation, the volume of fraudulent claims bearing his signature, and the $800,000 he had received. He was sentenced on February 7, 2023, to 60 months in federal prison. His medical license had already been suspended by the Texas State Board of Pharmacy following the indictment and was subsequently revoked. He was ordered to pay $4,900,000 in restitution. Derek Washington, having provided extensive cooperation, entered a guilty plea to conspiracy to commit healthcare fraud and money laundering on October 6, 2022. His sentencing was held in September 2023. The government filed a Section 5K1, one substantial assistance motion on his behalf. He was sentenced to 36 months in federal prison, a significant departure from his guidelines range, and ordered to pay $5,200,000 in restitution. Marcus Alton Briggs did not plead guilty. He proceeded to trial. His defense, presented over 3 weeks in August and September 2023, argued that Briggs had been misled by subordinates, that he had delegated billing operations to Washington and the Westheimer office staff and had no day-to-day knowledge of the fraudulent claim generation, and that the real estate acquisitions reflected legitimate business success. The defense attacked Washington's credibility as a cooperator, seeking to minimize his own sentence, and presented testimony from a defense accounting expert who offered alternative calculations of the Medicare reimbursement data. The jury deliberated for 4 days. On September 28, 2023, it returned guilty verdicts on all 18 counts. The verdict included the healthcare fraud counts, the conspiracy counts, and the money laundering counts based on the real estate transactions. Briggs was sentenced by United States District Judge Anita Marquez on November 9, 2023. He was sentenced to 216 months, 18 years, in federal prison. He was ordered to pay $194,600,000 in restitution to the Medicare program. The 3 real estate properties, the 14 bank accounts, and the assets seized during the August 2021 raids were forfeited to the United States. Judge Marquez, in her sentencing remarks, observed that the scheme had operated for 9 years by exploiting the trust that the Medicare program places in licensed pharmacies, that it had corrupted physicians and manufactured prescriptions for patients who did not exist or who were no longer alive, and that the harm extended beyond the $200 million stolen. It extended to the integrity of the healthcare system that legitimate patients depended upon. The data thread that unraveled case 5520 was a single analyst's cross-match on a Tuesday morning in March 2019. 207 claims, 41 deceased beneficiaries, 1 pharmacy chain. The Deathmaster file cross-match has been a standard HHS-OIG audit tool since the late 1990s. What had kept Meridian Pharmacy Group's fraud undetected for 9 years was not a deficiency in the audit tools themselves, but a combination of factors that the scheme's architects had deliberately engineered to stay beneath detection thresholds. The fraud volume was spread across 12 locations and hundreds of beneficiaries. The billing was mixed with legitimate claims. The majority of Meridian's Part 500 submissions were for real patients filling real prescriptions, which produced a legitimate baseline that made the fraudulent claims statistically harder to isolate. The corrupt physician NPIs provided a layer of plausible prescriber cover that automated screening tools were not calibrated to penetrate without the supporting documentary evidence that only a full record subpoena could obtain. What defeated those defenses, ultimately, was not a single investigative breakthrough but an accumulation of data. The Deathmaster file crossmatch identified the anomaly. The record subpoena exposed the volume. The beneficiary address analysis exposed the geographic implausibility. The NPI validation exposed the ghost prescribers. Washington's cooperation provided the operational architecture, and Reyes' testimony provided the human account of how a seemingly legitimate outreach program had been used to recruit and corrupt real physicians. The case produced several significant institutional responses. HHS-OIG updated its fraud detection algorithms to apply tighter cross-match windows between Part 500 billing dates and Deathmaster file entry dates. The Centers for Medicare and Medicaid Services implemented enhanced NPI validation requirements for pharmacy claims processing, requiring real-time cross-referencing against the NPPS database before claim acceptance, rather than during post-payment audit. The Southern District of Texas entered into an enhanced monitoring agreement with a number of regional pharmacy chains, requiring quarterly internal audit certifications. The case 5520 financial forensics were also used as a training case by IRS Criminal Investigation in its healthcare fraud curriculum, cited specifically for the 3-stage laundering architecture: Medicare reimbursement to management company to real estate LLCs to mortgage proceeds, as a model for investigators identifying fraud-funded real estate in similar cases. The pharmacy chain itself ceased operations on August 5, 2021, the day of the raids. The 12 Meridian locations did not reopen. The employees who had worked in the retail operations, most of whom the investigation had found no evidence of criminal involvement, dispersed to other employers. The buildings were eventually sublet or returned to landlords as the lease obligations of the forfeited entities were wound down. One detail stands in the permanent record. Among the 41 deceased beneficiaries identified in Figueroa's original crossmatch, the 41 people whose Medicare numbers had been used to bill for medications they would never take, the oldest was 92 years old at the time of death. She had died of congestive heart failure in a hospice facility in League City, Texas, in June 2017. Her Medicare number had been used to submit 34 prescription drug claims in the 14 months following her death, for a combined billed amount of $68,400. Her name was Esperanza Fuentes. She had been a retired schoolteacher, and she had never filled a prescription at any Meridian Pharmacy Group location during her lifetime. Case file 5520 is closed. Total restitution ordered $194,600,000. Federal prison terms imposed across 6 defendants, 374 months. Properties forfeited, 3. Bank accounts frozen and forfeited, 14. Medicare Part 500 claims identified as fraudulent, 41,209. Years the scheme operated before federal action, 9. The file is complete. End of record. Case 5520 HHS. Declassified.